by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@can.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIB is funded by the National Lottery Community Fund.
So, can we hear me?
Yeah.
Excellent. Good morning, everybody out there, and wherever you are joining us from. Good morning, good afternoon, good evening, as the time of the day may be. For those of us who are Christians, happy Easter celebrations, and our Muslims who are fasting. We hope all of these periods are periods of reflection based on whatever faith we belong to. I want to say well done to the Health Hour team for the Caribbean and African Health Network Group. CATHIB Health Hour has been going up now. And today we are going to be talking about perinatal mental health, something that is rife in our own Black and ethnic minority groups. It's more common in Black women, and we need to talk about things. We really don't talk so much about these things in our own ethnic and minority groups. So today, no other person to do justice to this than Dr. Mohammed Sore Ibrahim Kamara. And I remain Loretta Oduware Ogboro Oko. I'm a consultant obstetrician and gynecologist. And I just joked today with Dr. Kamara before we came on that it's quite interesting that a consultant A&E personnel is the one talking about this. But it actually gives us that breadth and latitude to understand that presentations can be to A&E for anything at all. And especially some of us in the ethnic minority groups where we have a paucity of information and we just generally don't know where to go. So let's welcome our A&E consultant as he does justice to this subject matter. Welcome, Dr. Kamara.
Thank you so much, Dr. Loretta. How do you follow that? I have reasonable adjustments to make today. So you would probably pardon my technical issues that I might face, as it were, as I'm at work, and sometimes the internet is not very robust or very reliable, so things may happen. Secondly, I'm on call, and so it might call me at any time, but hopefully we should be okay. I've left the team there, and I'm here now. And thirdly, I wanted to say how profound it is. Now, I don't know, I think Dr. Loretta alluded to that. I'm a Muslim, and it's so coincidental that in the past few years you have Ramadan and Lent coinciding, you know, and it's amazing how we're talking about reflection, sacred life, spirituality increasing in that particular aspect of life. And here we are talking about perinatal mental health. Now, for me, the most sacred act of sacrifice in this world is bringing a child to this world. Now, imagine that you are actually engaged in bringing a child to this world, and that act in itself is fraught with problems, challenges that you will not believe. Ain't it ironic how you're wanting to become a mother, and in so doing, sometimes you open a can of worms and you actually cause yourself more harm? But it's a blessed act. How ironic is that? Now, I don't want this to be a religious talk, but I just wanted to pay homage to the mothers and to the wannabe mothers. The reason I say that is because the Prophet, peace be upon him, as a Muslim, I'm quoting, somebody came to him and said, I need you to tell me who I need to be kind to. So, Prophet of God, I need you to guide me as to who I need to be kind to. And he said, don't think don't delay on this. And he said, why? He said, because the person you need to be kind to, first of all, is whom? No less a person than your mother. So he said, all right, okay, that's good advice. He said, but what about the second person after that? He said, your mother. And then he said, all right, okay. So first mother, second mother. What about the third? Then he said, your mother. So he said, hang on, this is becoming very bit serious. And then he said, okay, I don't know why you're telling me that, but I take that on board. And then he said, the fourth one, and then he said, your dad. And so the person then asked the question, oh, Prophet of God, why is it you want me to be 3 times as much, to be kind to my mom 3 times as much as I am kind to my dad? And then he said, just think about it. I know there are mothers in the group, but think about it. I don't know if anyone has broken a bone, but just think about that labor. And labor in itself, the pain in labor is equal to 42 fractured bones. I knew I'd shock you. Now that's it. That just tells you. This is why I wanted to pay homage to the mothers. So thank you so much for bringing us not only to this world, but making sure that we're well. And I think I remember Ms. Nicole Mbaga saying, "Speak mother." Oh, without further ado, let's talk about perinatal mental health. Now, as I say, we're just giving information here. We're not personalizing medical advice to anybody. If you have any queries, you can talk to me via Khan, or if you've got my number, you can talk to me, that's fine. But I don't give advice personally because I'm not indemnified. I'm not insured to do that. However, I can help as best as I can. And I know people have been doing that. So I don't have a problem doing that, but I don't want to be quoted as giving that. So the right person to contact is your GP, your general practitioner, or the specialist who's looking after you. All right. I don't know what's happened there, but I'm trying to go further.
I think you just make it slideshow.
And that's what I did.
All right.
Right, okay. There you are. As you can see, that picture depicts what I was trying to say. You look at this creation of God through you, and look at what is causing you. You can see the picture itself. It actually indicates, it typifies, and it embodies the problems, the divide, the distance between mother and child. Now, this slide, because we're talking about perinatal mental health, it can be quite sensitive for some people, and it may be triggering for some people as well. So I wanted to put this, as a trigger, warning you, just to highlight that if it is the case and it's getting too much for you, then you can leave whenever you think you can leave, please. Yeah, but I don't think you can leave here because we've not started much yet. Yeah, so bear with us. So what we're looking at today is, what is perinatal mental health? Why is it important? What are the common perinatal mental health conditions that you know or you might not know about? What are the risk factors associated? And what are the common symptoms? as well as what are the management options you do have. And above all, what are the support services that are available there for, people that may need them. So now a lot of people might not know this, but what we wanted to find out is whether people think that mental health issues, especially perinatal mental health, occurs only in a specific group of people. Some people might say yes, some people might say no. We'll find out as we go along, and I think you would find out that this is not just specified to any specific group. It can happen to anybody, even the men. That's what I wanted you to know. Yeah? Men also suffer from postnatal depression. No questions about that. It affects up to 10% of new mothers and the ones who are pregnant. Find out. So, what is mental health? Now, WHO, which is the organization that we all know about, that guides us into how we treat people and how we manage illnesses, defines mental health as this: a state of well-being in which an individual realizes, I hope you know, realizes his or her own abilities and can cope with the normal stresses of life, which life throws at you. So the stressors we do have, but if you can cope and you can realize your abilities and you can work productively, yeah, and you are able to make contribution to your community, whether you are a he or a she, then you have definitely got a state of well-being. Now, mental health is a positive state of mind and body. So without the body, definitely the mind would not work. So they go one in hand, pea in pod, as it were. You're feeling safe, you're able to cope with a sense of connection with your people and the communities that you live in and the wider environment, then definitely you are in a good state of health. So, and that just reaffirms it, that health is a state of complete physical, mental, and social well-being, and not merely the absence of illness or infirmity. I want you to be clear about this. Some people think when you are well, it means you have no illness. That's not right. The health is a state of complete physical, mental, and social well-being. So these three factors, these three components are interacting and interplaying and overlapping with one another. Not just someone tells you I'm not ill, then maybe they don't understand what illness is about. Because there are some illnesses that you can cope with, the body copes with, and you don't even know you have them. And it's only when they get beyond that level of, tolerance, that's when you begin to feel the symptoms and the signs. And then, of course, there's the need for help. So, but if your health is such that physically, mentally, and socially, you're okay without the illness that you can actually sort of know or think about, then definitely you are well. Okay. So perinatal health, as you can see, mental health is one, as you know, look at it. You can see on the left, you can see someone very weepy. She is pregnant, as you can see. And on the right, you can see this one's just had a baby, but they are more or less in the same category as well. So perinatal means it's an overarching term. It's a term that includes during the pregnancy and obviously having given birth and a whole year after that. So that's the period. That's why it's called perinatal, means surrounding labor, surrounding the birth of a baby. And as I said, men do suffer with that as well. So you can see there's a timely reminder. You have about 5 to 15% of men that suffer with that. And there is, you may not know, but there's depression and anxiety as part of this large term or large group of illnesses or statuses. So, as I said already, perinatal mental health, PMH, is the overarching term that you have for mental health during pregnancy and, of course, the first year following the birth. Now, it can be characterized by either pre-existing mental health issues or the conditions that may arise during the pregnancy or may be related to the pregnancy and, of course, possibly childbirth. As we said already, it affects up to 20% of new mothers and the ones who are pregnant or expectant mothers, as we call them, and covers a wide range of conditions, which we talked about already. 10% of those and 13%, 10% you can see is obviously in pregnancy, 13% is actually after the baby has been born, so postpartum. In developing countries, I'm sorry to say, the reality is we're higher, for obvious reasons, but we'll find out in detail what they are. So where you have, this is WHO itself, where you have 10% in pregnant women, in our countries, in the developing world, you have 15.6%. And on the other side of the spectrum, you have the postnatal, that is after the baby, it's 13% in the developed world, as they call it. And in our side, it's up to 20%. So you can see that definitely we suffer more. So why is this thing important, PMH? Well, it's because of the fact that many women are either unaware that they're struggling with it, with other issues as well, or put it down to what's expected in pregnancy or following childbirth. Now, a lot of people think, well, because you've had a baby, that means you must suffer. You actually be low in mood, you're tired, you're exhausted, you don't sleep at night, and you sleep only in the daytime and all that. You know, you're disinterested in the baby. Now, these are all telltale signs. These are things that people need to be aware of. Besides that, it's important to realize that a lot of people suffer in silence, and they put on this brave face, they have this golden badge of honor, but actually they're suffering. And sometimes it's that bad that they actually feel suicidal, which is the worry. Imagine a baby left on this earth with no mother, to care for them, because they've taken their life, and because they felt that bad, and because they didn't seek any help at the time they needed it. So, as you could tell, maternal suicide, women taking their own lives, mothers taking their own lives, is a leading cause of direct pregnancy-related death in the year after pregnancy. So it is a very real condition. Like 25% of women during pregnancy, up to a year after the end of the pregnancy, do have mental health-related causes. So it's a very significant problem, a really important problem. That's why we need to be raising the awareness, and that's why we need to be sensitizing our sisters, our mothers, our aunts, and our children, towards this issue. If we as a family observe or notice these symptoms, and they might deny or they might feel really stigmatized, so therefore they're denying it or they're secreting it, it is our responsibility as a family, as a unit, as a society, as a community, to act upon these and save the lives of the children and, of course, the mothers and the ones that are mothers to be. So again, the importance of this PMH cannot be overemphasized, because it doesn't only affect the mother or the pregnant mother, but it obviously affects the baby as well, and it affects the baby really badly. So in pregnancy, PMH is associated with small for date babies. So they're smaller, the growth is restricted, and so they're very small, And then, of course, you have low birth weight. And then, of course, the big thing is, because of that, you'd expect prematurity. It's very rife in these situations as well, because obviously they don't eat, they don't take care of themselves, and they can easily do things that are associated. And remember, the child depends wholly and solely on mom. If mom is unwell, the baby is unwell. So simple as that. So that can, trigger prematurity and premature labor and birth. Now, after the baby is born, then the PMH impacts the emotional side of things, the psychological side of things, the cognitive developments. So you see that red book that you have as mothers? Yeah, the milestones are there registered. In such cases, the children or the babies do not achieve them in time. And of course, the developments is sort of delayed. And as a result, we obviously have children who are really poorly as they grow. So it's important to think about these when we're dealing with our family members. So you might not know what is the commonest amongst these four. So there's depression, there's anxiety, there's obstructive compulsive disorder, and there's psychosis. Now, these are four important ones, and you can take any one of these and deliver a lecture on any of them. So I'm not going to go into them, but obviously you know then that perinatal mental health does have all of these. The commonest amongst them, you'll find out. Now, we need to actually establish which one of the biggest deterrent of people coming forward with perinatal mental health problems, which is that biggest deterrent. Why is it people decide to stay on their own, not come and seek medical support or medical help in time? Instead, they shy away. There are reasons for that, and that's why we need to talk about this. As I said, there's paucity of knowledge, there's stigma, there's social structural inefficiencies, incapacities, and deficiencies, and therefore we need to actually talk about this. I know it's a sensitive subject. Some people may have suffered with that, but it's important to talk about this so we know how to tailor the needs that people have. You know, for us to actually diagnose and treat, we need to know what the illness is. If we don't know the illness, there's no way we'll be able to diagnose it, and there's no way we can actually proffer the appropriate treatment. And therefore, it's important for that. Oh, just give me a sec, please. Yeah. Give me a sec, sorry. Yeah, as I said, they've just called me. Never mind, I'll continue. So, the common perinatal mental health conditions, as we talked about already, we talked about depression, anxiety, OCD, bipolar affective disorder, and of course, psychosis. And then we mustn't forget that there is PTSD as well. So, amongst them, depression ranks the highest, about 10 to 15%, followed, closely by anxiety, so about 10%. And then, of course, the OCD is about 3%. Then, of course, you have postpartum psychosis, which thankfully is less so prevalent, but it's really, really debilitating as well and can be really, really challenging. Bipolar can also cause problems as well. PTSD is there, but it's more to do with problems that preceded the pregnancy, so predated the pregnancy. So we have risk factors that are associated with the illnesses that we mentioned already. We have them, the social factors, which obviously, as you can see, top of them is poverty. As you know, as I said already, because of the fact that we're developing, continent, obviously we're fraught with poverty, and that's why we have a higher rate. Migration is another thing that actually aligns itself readily to this issue. Conflict situations like natural disasters, trauma, like you have famine, and places where there's you have earthquake, and things like that. Definitely, people who have been traumatized because of war. I don't want to name, but Rwanda, Haiti, as we know currently, Yemen, Gaza, as it is now. All of that. Low social input or low social support is one thing. Interpersonal conflict is another one. Exposure to violence, this is very important, whether it be domestic violence, emotional violence, sexual violence, and of course, violence in childhood. These are all, as I say, they do have long-term effect, and they do definitely cause PTSD, anxiety, and the rest of it. And of course, we know this bereavement. If you're close to someone, I've seen people who have had pets like a cat. I remember dealing with a man last week who had a cat for 15 years, and that cat has been part and parcel of his. And sadly, this cat, passed away or died, and he couldn't cope. So he took an overdose, and I tell you what, it caused him a lot of bother. He's still in ITU as I speak. But that could happen. We talked about stigma. Particularly in our cultures, people don't understand that, look, this is something affecting not only the person as an individual, but the family unit, as well as the society unit, and of course the environment. We're all affected by it. So therefore, we need to pull together for one another. Sometimes it's because of the lack of training that you have these problems. And then, of course, the other set of risk factors is personal factors, which are related to situations where you have unplanned pregnancies, or you have people who say, oh, hang on, according to my religion, I am a Muslim, or I'm such and such a devout Catholic and all that. and I'm not supposed to fall pregnant, and yet I'm not married, and then I've fallen pregnant, and now I'm going to be a pariah in my family, so it's unwanted, and that in itself triggers things. Stresses in life can cause problems and can trigger, the onset of, if you like, a spiral. Previous history of pre-existing mental illnesses, and of course, most importantly, if there's a family history. Now, that is important. So when you come to the doctor, they'll go through the history, family history, previous history of mental health or pre-existent mental health problems, and of course, traumatic pregnancies. People who have hyperemesis, we know vomiting continuously and can't keep anything down, and of course, traumatic birth, that could be a problem as well. Of course, there are times when women have to undergo the sad possibility of losing a baby, miscarrying, or maybe stillbirth, or maybe they would have been born alive, but then subsequently developed complications like sepsis, like maybe a heart problem, which may be hole in the heart, which is really, really profound. We call it tetrahydrophalo, which then causes problems, and the child could not survive, and then probably they die. Although nowadays it's better. And of course, in our groups, as well as society and sectors, ethnicity is a big problem. So the Black minority and ethnic people like ourselves are definitely more affected, and we're more at risk. So symptoms, as you can see all the 4 boxes or all the 4 squares. You have perinatal depression on the right, on the top, and you have anxiety, and then on the bottom you have psychosis, on the left, and on the right you have PTSD. Now you can see, with perinatal depression, you could see the telltale signs. So it's important to look out for the signs where they're depressed or they're irritable. So like swinging of the moods from one spectrum to the other, and diminished interest and lack of enjoyment in activities that they used to enjoy. And of course, they have this significant change in their weight. It's a question of either putting on too much weight or losing weight because they're not feeding as they should. Comfort eating and all that. And then, of course, sleeping problems, either too much of it or lack of it. And therefore, there's fatigue that stems from that, and there's tiredness that stems from that. And that feeling of worthlessness and that feeling of guilt that I brought, a life to this world, and I can't relate to this child. I can't relate to this baby. I can't seem to attach to this baby. I feel really distant. These are all, and of course, in that way, the consciousness is clouded. They can't think clearly. They can't concentrate on things they used to do. And of course, recurrent thoughts to the point where they think about taking their own lives. It can be one or the other or both of them. It's important to look at this thing. So if anyone is manifesting or exhibiting signs, it's important to seek help and seek help as soon as possible in a timely manner. Anxiety, as you can see, feelings of dread about things that people fear about, sleep disruption we talked about, racing thoughts. Even when the baby is asleep peacefully, they're still thinking all these ill thoughts and things. They're fatigued because of the lack of sleep. They get hearts racing, the heart is racing, they're sweating profusely, and they can hyperventilate. They're just breathing heavily and fast, and that in itself can cause problems. Then, of course, you got psychosis after having the baby, which is normally sudden. It just starts all of a sudden without warning. And people have these thoughts, delusional. They have beliefs that are definitely unfounded. The thinking is disorganized, and they have this evidence of confusion. The mood changes rapidly from one swing, one end to the other one. And then they begin to see things, hear things that are not there. Me and you cannot see them, can hear them, but they would actually feel them and see them. And they're reassured, they're convinced that it is true when we know it is not. Then the PTSD on the bottom there, as you can see, is persistently re-experiencing thoughts or sometimes dreams, both of them, flashbacks you get because of these distressed situations, stressful situations you've been in the past. They come back, like they say, they come back to haunt you. You're in a constant state of arousal, irritability. You're definitely hypervigilant. You're watching everything, making sure this is that and putting these things together in a way, something like, autism, but not exactly autism. you get exaggeratedly startled. Somebody shouts or claps their hands and you just jump, which is not in keeping, which is like, overreaction. These are all things that would actually tell you about PTSD. People who've been in the war, wars, when somebody claps their hands like that, you definitely would startle, and sometimes it causes you problems. And it's manifest. And of course, you get difficulty with staying asleep or getting to sleep because of that. So there are what we call red flag symptoms. These are symptoms that you should definitely not ignore if you see them on people or in people. If you see changes in the mental state, or new symptoms arising. So somebody is known to have mental health problems, but now they're different and they're changing, and then you see newer signs and symptoms, then you need to be really, really thinking about seeking help for this person. If the person, thinks or acts violently, self-harm themselves, or thinking about suicide, by all means, please don't delay. Do it ASAP. If you've got new and persistent expressions of incompetency, someone that thinks, oh, I tell you what, I don't feel I can do this. I think I am definitely a disgrace, a disappointment to my people, to my mother, to my parents, to my family, or you feel, detached, estranged from the baby, whom you brought in this world, then please, 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 people should definitely act as soon as possible before disaster strikes. So, why do people not come forward? Because of the stigma we talked about already. 9 to 10 people experience this, and it has a negative effect on their life because people judge, which is really sad. And that is not what we're supposed to be doing. We're supposed to be embracing them, encouraging them, right? Pointing them in the right direction and making sure we're there for them and making sure we are with them. Some people don't come forward because of the fear of the consequences. What if their babies were taken away by social care, by social services, or they put into foster care and all that? And of course, people are judging them, as I said already. They say they're unfit or they're a bad person. Some people feel shame, some people feel guilt. Some people think it's because they're not praying much, they're not being very pious, therefore they're being punished and all that. All of that is something we need to think about. Now, these are just some of the facts about Black women with PMH. Now, as you can see, almost 50% of Black mothers will experience MMH, that is maternal mental health conditions, so 50%, half of the Black women. I need you to understand what that means. And then, of course, twice as many Black women are likely to experience MMH conditions, but half are likely to receive care. Can you imagine that? So twice as many can experience the conditions, but only half would want to receive care because of the fact they don't come forward, because of the reason that I talked about already. And if you look at them, you can see on the left there, the non-Hispanic, i.e. the Caucasians, and the Hispanics are more or less similar. But then the non-Hispanics, like our people, they're definitely way out there in the front, as you can see. And of course, 6 times as much as the other group, single Black mothers are more likely than the general population to experience depression. So it's really stark, it's really grim, but that's what we're facing, and that's why we need to be talking about this, and that is why we need to be looking at how to get things moving in the right direction for our women folk, So, perinatal mental health, I would say, in Black women, we do have higher risk factors. There's a lot more stigma, a lot more cultural barriers, which we need to be talking about. We are underdiagnosed, and because of that, we are undertreated. And of course, there is this business of lack of cultural competencies in healthcare. So, as you can see, again, some of the stats you can see, 1 in 5 mothers are impacted by mental health conditions. As you can see, that's in the US. 75%, most women are untreated, as we talked about already, increasing the risk of negative impact, as it were. Mental health conditions are the leading cause of death. We've talked about that already, and it's an established fact, both scientifically and physically. We know that about $14 billion in America is what it costs to actually consider what this does to the economy. $14 billion untreated mental health conditions that are related to the women with the childbearing facilities, or if you like, characteristics, and each and every person, $32,000 a year, mother and infant. As you can see, 14 billion. That's not a small chunk of the economy. The GDP, definitely that's quite high. And it's not just postpartum depression. There are a range of these conditions that we need to be talking about. That we talked about: psychosis, bipolar, PTSD, obsessive compulsive disorder, OCD, anxiety, and of course, the highest of them all is depression. If you want to learn more, there's fact sheets that they have, and you can access them. So the factors that increase these MMH conditions among the Black women and people of childbearing age are, as you can see, racism, systemic, is a problem, especially where we are in the Western world. Socioeconomic status, because of low status, socioeconomic status, we're more at risk. Exposure to violence and trauma, especially in the Atlantic, as we see it. Gaps in medical insurance, as we know. In America, well, I don't need to remind you, but we're thankful to God for the NHS, because believe you me, America is fraught with these problems because of what they have. Medicare, Medicaid is costing a lot of problems and causing a lot of issues amongst our people. Childhood experiences that were adverse definitely have an impact, a very significant impact. And there is a lack of representation in the medical care system. And of course, we have higher risk of pregnancy and childbirth complications amongst our people. Our female folk, we definitely have this, and therefore we need to be aware of this. We need to be sensitizing our women folk, and we need to making sure that they're looked after, they're cared for, and their needs are catered for in a bespoke manner. So the lack of access to high quality medical and mental health care is also another reason. So this is all what we look at, we talked about already. Now, there's a website there, the bit.ly/SDOH /HHS is one. If you want to, check them out, you could actually see what we're talking about, and maybe you can get more information and more issues to help you with. Now, management, as I said already, your time is of the essence. Time is money. You have to act in a timely manner. You don't wait until the disease has actually, taken hold of the patient, wherein, the possibilities of reversal are quite slim. You need to act really, really bang on time, as I say, spot on. Catch it early. If not, then stabilize it and treat the condition before it takes control or takes hold. You have to consider whether you have to do it before conception or during the pregnancy, and then you can refer to the specialist, for perinatal mental health services. If there are previous mental health conditions, then obviously they need to be monitored, they need to be cared for whilst they're pregnant. If at all they're controlled, remember the pregnancy can actually trigger it, and then things worsen. If they have an eating disorder, or they have schizophrenia or bipolar disorder, you definitely need to consider that before they undertake that journey, that big task of conceiving, or if at all that has been missed, but during the pregnancy, 100%, it is important to get them checked, assessed, and kept monitored. If there is a previous treatment for mental health services on the record, again, these people, before they fall pregnant or during the pregnancy, definitely would need to be assessed. And of course, the treatment includes psychological therapy. They will probably give you medication to stabilize you and maintain the status quo. And of course, if needs be, they can then admit you to hospital with a view to stabilizing you and getting you better for the benefit of your child or the benefit of the baby that you're carrying. There are services that are available, as you can see, from the GP or the primary physician, as they call them in the US, the midwives. They definitely are sometimes, and of course, the specialist mental health nurses, midwives. There are those there who can help. Health visitors, obstetricians, and of course, we've got the doc, able host. She's also capable of doing that. We have pandas, and these are the child units. We have mind, we have tummies, we have children's services, and of course, we have psychiatrists, and we have clinical psychologists. These are all services that are available and at our beck and call if you like, our need. So what can we do? Well, we need to be aware of these conditions. We need to support our, women folk, as I say, very early. I can't stress that enough. The stitching time saves 9. This is literally what it is. Definitely. Ask for help. Don't be shy. Don't back away from doing that, because you would only be harming not only yourself, but the family unit and the rest of them. Yeah. Support individuals going through these, raise awareness about what you've learned today, and of course, help break the stigma surrounding mental health problems, especially in perinatal mental health. We have to adopt this multifaceted approach. We address social determinants of health. We promote culturally competent care. We dismantle systemic barriers to access and treatment, to access the facilities, and of course to treatment. Community-based interventions are a thing that are now being developed. The policy changes and the implementation, and of course more resources and funding for perinatal health services within our community. Research to better understand and address the complex factors influencing perinatal mental health outcomes in Black women. So this is the last thing I'm going to say. So take-home messages. 1, PMH has problems, and it's very important to understand that this is a real problem and it's a common problem. Remember, it's not restricted to just one group of people. It can happen to anybody. And please, 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 whatever you do, ask for help, seek support, don't suffer in silence, and you are not supposed to do this on your own. You're not alone. There's a lot of help, a lot of support, both in the family, in the near, and in the far and the wide. You definitely need that. It's a unit that will make you improve, get you better. Recognize the red flag symptoms, act upon them as soon as possible. Mental health is equally as important as physical health. Remember, there's no physical health without mental health. Both go hand in hand, hand in glove. No questions about that. So thank you so much. And these are my references. I'm afraid, I'm sorry, I'll have to leave you. Thank you so much for that. And maybe Dr. Loretta can continue with me. Sorry, I'm sorry about that.
Thank you so much, Dr. Kamara. Thank you so much. That was simply fantastic.
Thank you.
Thank you. It's a pity you have to go.
I know.
But we'll take the questions. But honestly,
if anything I can do, by all means, you can send the questions to me and I can answer them as best I can.
It's okay. I'll answer them. I'll answer
all right.
them.
Thank you so much. Apologies for that. Thank you.
No problem.
Thanks. Bye.
I want to say a big thank you to Dr. Kamara for that. I just want to emphasize that it is really important that as an A&E consultant, he did this presentation, because a lot of our women present via A&E. And he made it clear that the intersections of race, poor socioeconomic status, illegal migration, sociocultural beliefs and stigma, traumatic birth, and all of these things could actually cause a lot more of mental health issues in the perinatal period in Black and ethnic minority women and fathers as well. If there's nothing we've taken away from here today, is the fact that fathers are also affected, about 10%. So I've been looking at the charts. I want to thank Share Class. By the way, we can have more come into the chat, please, and ask questions or raise your Zoom hand, whichever you prefer. Share Class told us that, I feel that some of our cultural expectations of having children can put pressures on women to just get on with it. The usual thing over the centuries, women have had children mentality. So in our own sociocultural parlance, we just, oh, get on with it, you are pregnant. Why are you being such a precious woman? And this is very important. Thank you, Share Class, for this comment. It's not a question, but a very, very important comment. And in our families, in our sociocultural constructs, you have sisters-in-laws, mothers-in-laws. Sometimes they are not very kind to us. Sometimes they just make it look like, what are you talking about? when they can actually be the first line of help and defense. So if there's anything we take away from here today, it is that we should be treated the way we want to be treated. We shouldn't say because I suffered this in my husband's house, so I'm going to be unkind to my own daughter-in-law. Our own daughter-in-law is also our own child. And it is interesting that Dr. Kamara pointed out that Black women are twice as likely as white women to experience mental health conditions, and half are likely to receive care. Now, why is that so? It's probably because of the stigma. Nobody wants to talk. Sheklas went on to say, how can we navigate the waiting times to be seen by the GPs? The increased waiting list is having an impact. Now, this is a question from Sheklas as well. And interestingly, the best way to navigate waiting times to be seen by GP is some of the things that Caribbean and African health are doing now. When you are empowered with information, you have no doubt. You call your GP today, they've not answered. You call tomorrow and say, I have these red flags, and I think I need to be seen urgently. And the next thing you need to do is ask the name of the person who is answering your call. Please, can you give me your name? What is your name, please? That does something. These are little tricks I'm just telling us. That does something immediately to the brain of that person who answered your call in your GP surgery. They now know that you know who they are, and they now know that when their accountability whistle blows, their name is going to be pointed out. So they are going to actually do your bidding. And don't be tired. It is your right. Be persistent. Again, you can use some persons in community. Last week, somebody called me. They were having certain problems. And I actually made a call to that GP service, introduced myself nicely, and actually said, you know what, I don't think I should be making this call, but I'm making this call because of things like 5 times more, 4 times more. Who can I speak with? And they gave me someone to speak with. And I made that plea on behalf of that person very nicely. And the person was seen the next day. So as a community, we need to rally around each other, and we need to be able to use the places where help can be accessed. We need not to be anxious about demanding what is our right. And for those of us who don't have legal status, the GPs will not deport you. Please, I say here today, the GPs will not deport you. They will attend to your healthcare needs. Don't hide away. And then Benedict Aristotle says, a lot of these symptoms can be flagged earlier in a present community. So I would imagine, Benedict, you mean when we are there in a present community, when we are there for each other, when we are actually present, when we observe one another, when we can pick out the red flags. I think that's what you mean, if I'm right. And you are right. A lot of these symptoms can be flagged up earlier when the community itself is present, when people are there and present for each other. You can ask nicely. Some socioculturally may think, okay, thank you, I see you said that's what you meant. May think, oh, am I being nosy? No, and we can start from our houses of faith. If you don't see a sister or a brother in mosque, after a while, 2 times, if not, you should be able to ask, where is this brother? Where is this sister? In church, in our community gatherings, we should be able to ask, what's happening? You know, well done. Thank you, Benedict, for that. Share class comments again. We need NHS England to bring an increased parity between mental health and with other illnesses such as COPD and CVD, etc. True. Importantly, we must push. We push as communities. We push as individuals. We push from everywhere we are in. It's a marathon. It's not a sprint. And at the conference, the summit held for Black Inequalities Monday past, these are some of the big ways we can push. and call out those who are responsible for policies and decision making. NHS must bridge the gap, and they just have to, because mental health is as important. If you think about what Dr. Kamara said, you know, the fact that you do not see the amputated limb or a hand or a leg, the fact that you are not seeing someone's hair is falling off from cancer treatment does not mean that they are not as unwell. Their mind is unwell. They are not in a state of well-being. And yes, the parity must be breached. Thank you very much, Share Class, for that comment. And then we shouldn't lose sight of the risk factors that were pointed out. I just want to use this opportunity to reiterate this. Systemic racism, socioeconomic class, and gaps as well. Importantly, a family history of mental health issues. And this is why when women come in at booking, the obstetricians and gynecologists, the midwives, we take a very detailed history. I find that sometimes as Black people, we tend to hide some of these things. They are not asking it to stigmatize us. They are asking it so that they can have a proper pathway planned for our pregnancies, for our care, for a multidimensional input into whatever happens to us. So please, let's disclose these things. I know we have a culture of not speaking, but let's start speaking. In fact, that's the very beginning, and someone stated it. If I go on to the next one I have here, it says domestic abuse, and this is Ruth. Ruth says domestic abuse, childhood trauma, and past experience of sexual abuse are associated with higher rates of poor perinatal mental health. What can we be doing in our communities to mitigate the risk associated with these experiences? Talking about these issues and breaking the taboo is a start. Well done, Ruth. You not only asked the question, you actually proffered an answer. People don't talk about sexual abuses, especially in African communities. And you still go to your GP, you go to your midwife, you go to your obstetrician, you still don't talk about it. You need to, because that's a red flag for us. That's the reason why we will even plan how to manage you in labor. Women, do you know that women who have had sexual abuses, we even try to reduce the number of times we do VEs and examine them in labor. So if you don't disclose these things, if we don't talk about them, we are actually shortchanging our own self in the system. You know, even when the system wants to work for us, we're actually disadvantaging the system. And then Share Class goes on to say, some of the people I have spoken to feel that the policymakers are not interested in preventive measures. Instead, they are interested in curative and treatments, which are more costly to parents and communities. Yes, well said, well expressed. You're right. But sometimes when we make it obvious as well, when we let people know that, look, this is the cost. A woman who has mental health issues around the perinatal period is likely not going to resume work on time. Is likely going to extend the maternity leave. And you are going to lose even as an employer. So we need to push these statistics like Dr. Kamara did when he was presenting. We can see the billions of dollars, millions of pounds that are being wasted simply because we've not acted in a preventive manner and encourage communities to actually do what is right for their people. So kudos to those who sponsor the Caribbean and African Health Network, who sponsor this health hour, because they are actually investing in prevention, which is far, far cheaper and wiser than cure. And then from YouTube, we had, how can we raise awareness with the importance of using interpreting services instead of partners or relatives to interpret, especially with global majority of patients with limited English, please? I like this question, and it's come from the YouTube. You see, the problem is the NHS over time is trying to save cost, When I started out in the NHS in about 2006 in this country, we had to have face-to-face interpreters. It made more sense. And they actually took that job away. The rule was that you didn't want the relatives to interpret, because we had cases where you are telling the man what to say and he's saying what he wants to say to the patient. We've had those kind of cases as well. But over time, the question of funds and saving money has meant that the NHS is now deferring to other measures. But we can use the telephones. Sometimes in emergencies, they are not there and you are forced to make use of relatives. But where possible, the telephone and the big word and now Google Translate is all being used. But yes, this is a very strong point and a good question from YouTube. How common is it that the mother experiences psychosis during the pregnancy, or does psychosis only occur in postpartum period? That's a good question. Psychosis can also occur during pregnancy, especially in people who have a previous background of mental health issues. So if a woman comes and says, oh, I actually have a history of bipolar disorders, or I have a history of schizophrenia, we take that very seriously. We even have specialists dedicated obstetric antenatal clinics that follow up this kind of women, ensuring that they are taking the right medications in pregnancy. Sometimes we have to swap medications so they don't affect baby, and we follow them up properly. Sometimes some of them may require more scans than the average woman in pregnancy, because some of these mental health issues, understandably, are linked with substance misuse. So it is very important. It's not only in the postpartum period. That's a very good question. Does a previous experience of psychosis in the mother before pregnancy increase the mother's chances of experiencing poor perinatal mental health, whether re-experiencing of psychosis or other mental health condition? Yes, it does. Because the hormones of pregnancy, progesterone and estrogen, are such that, I mean, imagine even just during one's periods, during menstruation, imagine how depressed or anxious we can become. And that's just because of the hormones. So imagine in pregnancy, when the circulatory levels of these hormones are like 50% more than you've ever experienced. And in some people, even a lot more if you're having twins. So everything can really go wrong, and you can have a worsening of previously existent mental health issues. So people who have had psychosis before are more at risk, and we don't joke with them at all. In fact, they are special and unique patients. And this is why if you don't disclose that you have these things before, you're actually shortchanging yourself. The system is looking for you. The system wants to treat you. So please do not hide this information away when you are being asked at booking. Always giving, Nusrat Achebong says, always giving us the best information and awareness. Oh, thank you for that. Bisola Sonoki says representation has a significance in these situations. True, very, very true. Perhaps the system needs to also ensure it is asking the right question and explaining why the information is relevant to support accordingly. That's very true. In the hospitals I've been before, I had a training day with some of the midwives, and I did tell them, when you have a particular set of people, you may need to reassure them more than others because of cultural differences. So when you are asking them any history of mental health issues, when you're asking them any family history, just tell them why. Don't just ask the question and stop, which is what I think Bisola Sonoki is trying to say here. So the NHS also has the responsibility of training the staff to be culturally sensitive and to be prepared for a cosmopolitan Britain, because more and more we are getting more cosmopolitan. It's a melting point of such with the massive migration figures. That's very true. So the system needs to ask the right questions, and they need to, more importantly, explain why the information is relevant, just to reassure people. Okay. Are there any more questions, Ruth? We seem to have taken them all. Are there any raised hands?
Yes, that appears to be all the questions so far, but if anyone has any other questions, please do feel free to put them in the chat or
So Pamela just said, oh, okay, Pamela is saying thank you so much to the presenter and the host. It's fantastic. Thank you very much, Pamela. We can only try. We will always do our best. I think there's something I really want to talk about, something we need to take away, and that is the fact that we are not alone. Mental health issues can happen to anyone. It is no respecter of social class, even though we know it happens a lot more in low socioeconomic status, but we've seen women, high-flying women, we've seen men in great professions actually coming down with mental health issues. Suffice it to say here that on the generality, the most people affected with mental health issues are priests and doctors. It cannot be far-fetched the reason why. They have a lot of burden on their shoulders and they don't have people to unburden to. And even amongst doctors, the anesthetists are very much at risk of being suicidal and actually committing suicide. So now imagine if you are a doctor, you are a woman, you are pregnant, or you are the partner of a woman who is pregnant. You are more likely to actually develop perinatal mental health issues. So this goes to tell us that it's no respecter of persons, no respecter of social class. But we do know that certain groups are more affected than others. So it needs to be taken into cognizance that we are not alone. Okay, more questions are coming in. We are not alone. It can be anyone. And it's nothing you've done or not done. Pamela is saying, how is perinatal mental health managed in our African and Caribbean countries? Can we draw similarities in relation to prevalence of poor mental health? Thank you, Pamela. I mean, I just came back from Nigeria. I was there for a while and I go quite often. And sadly, we are not paying attention to mental health issues. There's still a lot of stigma that surrounds it. There's still a lot of poor support in terms of managing mental health issues, either perinatally or in the general population. Sadly, I must admit that the resource-rich nations are doing better than we are. You still find people being locked up in rooms and being isolated from society because they have mental health issues back home where we come from. And these are the things that we need to stop. We need to understand that it can be anybody. You find the concept of people talking about juju, talking about enemies of the father's house over religiousness, and they victimize people and say some of the mental health issues are a result of the sins they may have committed. I've heard people say that women who have postpartum psychosis are being chased by the spirits of children they have aborted in the past. I mean, these are the things we need to stop, and it will be a grand thing if Caribbean and African Health Network here can start collaborating with willing partners back in our home countries as well. It should be something we should be looking at in the future so that we can also have a reach across borders. That was a very, very great question and comment. Jerina Spicer is saying, as a Black African woman and healthcare professional, I've noticed that our health-seeking behaviors are different to the typical or the norm. Historically, we can be taught to be strong. We therefore tend to seek medical attention when we reach crisis points. Just a reminder to all out there that we should and must access help as early as possible, as there are different options available: guided self-help, talking therapies, counseling, or CBT, cognitive behavioral therapy, medications, etc. I want to say a big thank you, Jerina. You're very right. And this being a strong woman or a strong person phenomenon in the Black in the Black ethnic minority groups is something that we need to deconstruct, because even when you are telling your partners and the people around you, I am unwell, I don't feel up to it, they don't take you seriously because they expect you to be that strong Black woman. So without you knowing, you have to fit the societal construct where you come from. So you are very right. We need to deconstruct this. We need to look out for our others. We need to actually know that when someone complains to you, they need help. And we also need to know that we need to speak out. We can't keep saying we are that woman of Zion. We can do all things through Christ who strengthens us. Why did Christ put people around us? Does he come down himself? No. So we must know, and I really like what you pointed out. We must break these social cultural barriers. We must have a sort of cultural integration. It is okay to speak up. It is okay not to be okay, But again, those around us must know, like Dr. Kamara pointed out, to look out for us. And you are right. It's not always medications, if that's what you are scared of. You can have cognitive behavioral therapies. You can have talking therapies. You may just need someone to listen. And most times, this is why people even run to church more than to doctors. Because a 5-minute consultation is not enough for a woman to unburden her mind. Sometimes they find more help when they go to their pastors or their imams. And that is why we must not underestimate the usefulness of these houses of faith and community groups in managing this. Thank you, Olanike Babalola. Brilliant presentation. Dr. Kamara has been fantastic. Can I suggest that the health hour be publicized more on our groups and social medias to have more participants at these health hours? I think that's a burden for all of us. How many of us here today shared the links, the flyers with our groups? I think we should start from each of us. We shouldn't leave it to CAN alone or CAN members alone. How many of us? Yes, I know you did. I know some of us here did. But we should keep doing it. It's a journey. It's a process. It's not an end point. And then we must understand that our communities, we are so interested in chasing money, more shifts. Even when we are supposed to gather information, we don't go. If we said we had a party today at CAN, I'm sure a lot more of us would have showed up. But we won't stop. We need to have a paradigm shift. We need to try and shift the way we think about things. And we need to understand that we need to push our people so that they begin to understand what has value for human life, what matters to us. I thought I saw a Zoom hand up. Can we unmute that person? All right, if that hand is not up anymore, I can't see it anymore. I want to say a big thank you to everybody. We can always watch the recording again. We can also send the links of the recording to our groups, our loved ones. Oh, Jerina, your hand is raised. We'll quickly unmute you. Be very brief because we need to hand over to the person who is doing our closing slides. Please, can we unmute Jerina, please? We won't take more than 2 hands, please. Just the 2. And please be very brief. Jerina, I've asked you to unmute. Go on.
Sure. Thanks, Loretta. I may have missed the beginning, but I wondered if we've mentioned racism, because it does play a significant part in, I suppose, how we also seek and receive mental health care as well as physical health care, because sometimes just touching on my point around about being strong, but racism is a huge contributing factor. I'm a mental health nurse, by the way, by background, and so I have seen people being sectioned when really they could have been picked up early on, etc. So I just wanted to just flag it, that racism does play a significant part in. Yeah.
Thank you, Jerina. Thank you. It was mentioned, institutionalized racism, and I also talked about the intersections, and Dr. Kamara as well, of race and
brilliant. Thank you. Sorry.
Status, as well as illegal migration. We did touch on all of those things. Bisola Sonoki, unmute, and I think I've asked you to unmute. Yeah.
Hi, thank you. I'd say this tongue in cheek, really, but you mentioned earlier about, if there's a party, everybody will be there. Perhaps there is an opportunity in itself to deliver messages. Now, maybe Khan should have a party and therefore deliver the message at the party, because then you have more audience. So, and as I say tongue in cheek, of course, but maybe we should recognize the opportunities of the fact that you have a bigger audience.
That's fine. I like your suggestion. So Khan should be hosting Saturday parties now, or once in a while. We can say every 3 months it's a party, and let's catch our people. We know where to catch them, so let's catch them. That's a good point. I'm sure the people here will pass that on and they will look into it. But that may mean more budget, and we'll see if our people can sponsor that. So on that note, let us bring in our friend Benedict, who is going to be doing our closing slides today. Thank you, everybody, for listening. And like I said, share, and share. Share the recorded link, share the invitations. Thank you.
Thank you, Dr. Loretta, and thank you, Dr. Kamara, for delivering this insightful session. I hope everyone takes away the insight and the wisdom that was shared today. And if you are interested in this session, then we can present the closing slides to you now and see when the next one is, which is the 6th of April, 11 a.m. to 12:15 p.m. The details of the session will be shared closer to the time. If you just sign up.
Sorry, Benedict, we can't see your slides. Could you please try sharing them? We can hear you okay, we just can't see the slides that you're looking at.
Okay.
Thank you so
Can you
much.
see?
Yeah, that's
see
just
now?
about to load.
Yeah, so
thank you. We can see it now, yeah.
Yeah, so as I said, our next session is on the 6th of April. If you want to register, just register with this email here or just through this link here. These slides will be shared after the session. On Tuesday, the 2nd of April, we have a session regarding what is the better and healthier option between red versus white meat. We have doctors, we have guest speakers to speak through this topic with you. It should usually be an hour and a half, but yeah, feel free to join, ask questions. Like I said, register through this link just here. Then we have our initiative, which is Homes for Health. So this is basically making private housing conditions in Gorton better. So yeah, if any of these questions apply to you, then feel free to join and call our helpline that we can discuss these issues through with you. Then we have our lung health check. So if you're located in Camden, Enfield, or Haringey, between 55 and 74, then join over 40,000 local people to check your lungs. I mean, this is very important. Seasons change and stuff. It's good to have that clarity going forward. And then we have improving the heart health of the African Caribbean community. This is an initiative where we provide services for 40 plus people in Moss Side, Rossholm, Home, Ardwick, Longside, Openshaw, and Clayton. And then we offer free health assessments, i.e. blood pressure checks. So feel free to register with this email here and contact number as well if you'd like more clarity on that situation. But thank you for joining us, and we'll see you next week.
Thank you very much, everybody. Thank you.